Kennedy Jr. testified before the Senate Finance Committee yesterday. Joining us now to discuss the takeaways is Jeffrey Tucker, the founder and president of the Brownstone Institute, a nonprofit organization focused on the post-pandemic freedom and reform. He's also the author of Life After Lockdown. Jeffrey, good afternoon. So I'm sure you watched the hearing yesterday. It was quite heated in some moments, I would say. What was your number one takeaway, the number one thing that stood out to you in the hearing?
I don't know. I watched the entire thing, and it wasn't just a few moments. It was the entire thing. It was seemed to be a premeditated attack from the very beginning all the way to the very end. I don't know how it is that Bobby, or I should say Robert F. Kennedy, was able to hold up that entire time. I thought he handled himself masterfully. He tried not to lose his temper, but he also, they wouldn't let him get a word in, present his evidence, his thinking, his rationale. Fortunately, he's on many interviews all the time, so the American people have a chance to see who he really is. But they really didn't want him to talk. They wanted to use it just for grandstanding and a politically motivated attack. I found it actually quite shocking and disappointing. And then today, to see so much of the national media on the left and the right and the middle and everyone in between doing the same thing all over again for him. And I spent most of the day trying to think about, what this could be. I know that he's attacking a very powerful industry, pharma, and attacking and questioning some very revered practices like vaccination. But he deserves a hearing, that he deserves to be listened to. And I think this country is making a grave mistake by this sort of attack on Bobby. He really needs people's support right now, I think.
So going into some of the specifics, and you can talk about any point you want, but Kennedy said yesterday the CDC's data chaos makes it hard to quantify either the benefits or the shortcomings of COVID-19 vaccines. What was your reaction to that?
Well, there was a strange moment when they asked him how many people died from COVID, and he said, I don't know. So it's not that he doesn't know and everybody else does, it's that nobody knows. And that was a very intelligent and very striking comment, because we had rampant, this is not in dispute, we had rampant death misclassification among all ages. Even from the early part of the pandemic, Deborah Birx announced from the White House that they were going to classify anybody who died with COVID as dying of COVID. Okay, that was said, and I'm going to say this was sometime in the summer or even earlier of 2020. At that moment, she blew up the data. So we have very bad data, and we know for sure that the CDC wildly exaggerated infant and childhood death from COVID by this one little data trick alone. And then you add to that the inaccuracy of the PCR tests that were widely used in the early days. They had as many as 90% false positives, as the New York Times itself admitted back in those days. So if on one hand you're classifying everybody who dies with COVID as having died of COVID, and then using a PCR test with 90% false positive to classify them as having having had COVID, which is not the same thing as being sick. It could mean just being exposed in some way. So you have a major data problem. So we are at the point now, and this is extraordinary, that we actually do not know. Nobody knows how many people in the US died from COVID. We don't even have a really clear sense of what's called the case fatality rate, or even a clear sense of the infection fatality rate. I mean, it's amazing to think that, and this is what he was trying to draw attention to, that in the age of science, the age of data, and so much disease surveillance and everything else, that the public health agencies could have messed this up so much that we actually know less about COVID now than we have since the early days of the pandemic. I mean, it's absolutely extraordinary. So he was trying to explain this, and these politicians gathered there just didn't want to hear it.
Okay, there's another topic I want your opinion on. So Florida Surgeon General is working to eliminate vaccine mandates, including for school children. While medical freedom advocates will praise this move, there may be some parents, I'm sure, concerned about what this means for their kids. So what can the Florida government do to justify its decisions to those concerned about epidemics in schools and other environments?
I saw that press conference with Dr. Joe Ladapo, and everybody was cheering. People were crying in joy over it. We need at least one state with medical freedom, and we can judge the health outcomes afterwards. Of course, he's not saying any more than RFK is saying that if you want your child vaccinated, if you yourself want to be boosted for COVID or whatever else you want, you can get it. It's not as if these shots are banned. All he's doing is not requiring them of people, violating people's conscience, really. And, what you see right now happening is in these states that are actually tightening vaccine restrictions are losing residents to the states that are allowing more medical freedom. So people are going to places where they're not having their kids forced to accept these jabs that many people are gravely suspicious. The childhood schedule is blown up so much over the last several decades that parents are starting to worry that it's too much and they want the freedom to choose. That's all he's doing. I also find it striking that so many people the people who object to this are saying that they want other people's children to be vaccinated, even though their own children are vaccinated. If you're vaccinated against a stable virus, you're not going to get it regardless. If you get the chickenpox vaccine, you're not going to get chickenpox. It doesn't matter if the other kids in the classroom are not vaccinated against chickenpox and get it. It shouldn't affect you. Like, if you really believe that vaccines work, you shouldn't worry about what other people have. You understand what I'm saying? It's absurd. I also do want to comment really quickly on something I think is a little exaggerated concerning Robert F. Kennedy and his tenure at HHS. The moves he's made to change the childhood schedule are just very, very small ones. He's only made one change in the childhood schedule, which is to remove the COVID-19 booster from the recommended shots. Children are of vanishingly low risk, near zero. The boosters that are out there now do not even pertain to the strain that exists. We know that the shot's effectiveness only lasts 3 or 4 months anyway. It makes absolutely no sense by the data or the logic or anything else that the COVID-19 shot should be on the childhood schedule recommended by the CDC. That's all he's done, is taking it off the recommended schedule and recommended that it only be for extremely at-risk populations that are more elderly as an option. So that's the only real change he's made. Beyond that, he's mixed up a little bit the advisory commission on immunization practices by firing all the old people who had conflicts that are being paid by the pharmaceutical industry. That is not in dispute. That's not in dispute. They were all being paid by pharmaceutical companies for the very products that they were charged with regulating or advising on, and replaced them with independent experts who are genuine medical doctors, genuine statisticians, actual people who understand this industry but don't have industrial conflicts. That's all he's done. That commission will meet in about 2 weeks for its second meeting, and they're going to be considering some very important shots. So these are very important, essential changes. He was given the task of getting into these public health agencies and doing something to uproot the corruption and restore trust, and that is exactly what he's doing.
Well, okay, Jeffrey, we're out of time today, but I always enjoy hearing what you say. Thank you very much.
Okay, my pleasure. Thank you.
A U.S. congressman is urging the Senate to pass the Stop Forced Organ Harvesting Act. This comes after Russia's Putin and China's Xi